Violet is 31 years old and was referred to OT for a right flexor tendon laceration following a suicide attempt. She lives with her parents and has no siblings. She's Roman Catholic while her fiance is Jewish. She works as a bookkeeper at her father's furniture store, and she presented with no functional limitations and was independent in all tasks prior to injury. One of her goals is to regain full function of her right hand, and a motivating factor for her is that she doesn't want to appear different. One thing I would ask the hand surgeon is if there were any complications during Violet's surgery. I would get this information by calling them or their office, and if after multiple calls I don't hear back, I might consider visiting the office to talk to the physician face to face. One of Violet's strengths is that she's left-handed while her right hand is the affected hand. This will make the process easier for Violet as her dominant hand is unaffected. Another strength is that she is independent in her mobility and self-care tasks, and she even reports to the OT that she's been completing some of her self-care tasks one-handed. Another strength I would consider for Violet is that she's young. Since Violet is 2.5 weeks post-injury, precautions would include no active flexion of involved digits unless cleared for early active motion, no passive wrist extension, no passive finger extension, and no functional use of the involved hand. Not following these precautions would delay the healing and recovery process for Violet. It could also cause complications if they aren't followed. If Violet doesn't follow her exercise protocols that involve movement of the injured area, this could increase the chances of scarring and can lead to stiffness and possibly contracture. I would continuously educate Violet on her injury and recovery process and explain to her the possible negative outcomes if precautions weren't followed. Regarding the absence of Violet's work role, I would explain that due to her current condition, she needs to focus on recovering. I would explain to her how in therapy we are working towards her return to work and there's no rush as that can cause further problems. If she were to ask me to talk to her father about it, I would tell her that I would talk to him if he brings up the subject as she needs to focus on her recovery and then we can focus on her return to work. I would explain to him that we will reevaluate once she has made some progress to determine when she is able to return to work. I personally do not think Violet is physically or emotionally ready to return to work currently. She needs time to recover physically and time to adjust to her new antidepressant medication. If Violet's job entails typing on a computer, she may have difficulty and could instead use voice-to-text features. Another accommodation I might consider is giving her a different job at the store that would require less movement of the wrists and hands than her current bookkeeping job. To care for her splint, I would tell her to keep it dry, keep it away from dirt, and when washing Velcro and possible cloth lining, use soap and let air dry. I would also explain to her that she needs to keep it away from excessive heat or it could change the shape of the splint. At this time, I would not be working on strengthening with Violet as she is 2.5 weeks post-injury and strengthening activities are done about 6 to 8 weeks post-injury. At this point, I'd be focusing on things such as edema control and light self-care ADLs. A home exercise program for Violet would include passive composite fist, passive DIP extension maintaining MCP and PIP in flexion, block MCP in full flexion and actively extend IPs, and passive DIP flexion and active extension. Some others include passive PIP flexion and active extension, isolated FDS glide of unaffected fingers, and passive wrist flexion followed by active extension to splint limits. For scar management, I would use compression as well as massage. This will break up scarring to prevent contracture from occurring. One treatment I would use for edema management is compression. Other treatments for edema I would use are elevation and movement. I would educate Violet on the need to use these techniques outside of therapy to improve her outcomes. To address her decreased attention span and recall, I would incorporate short breaks in between activities in the therapy session. I would also keep each activity short so that I can keep her attention. Another thing I could do is incorporate some of her interests to make the therapy session interesting for her so she doesn't lose focus. This injury might have put a strain on Violet's relationships with her parents as it is keeping her from working. It also is bringing about changes in their daily life and routine, which can cause a strain on any relationship. I believe this relationship with her parents, however, will hinder her progress. Just as this injury might put a strain on Violet's relationship with her parents, it can also put a strain on her relationship with her fiance. Her relationship with him is good, and I believe he would be there for her through her rehab process. However, the parents are who I'm worried about, as they already do not approve of their relationship. I believe Violet's relationship with her fiance can have a positive impact on her progress. He's someone that can provide support and motivation as she progresses. However, parents might be a difficulty which can hinder her rehabilitation. I think it's important to address Violet's depression in outpatient OT as well. While she is also seeing a psychiatrist for this, it is important to address during sessions because how she is feeling can greatly impact her productivity during sessions. If Violet's father came with her to one of her sessions and began demanding I explain to him why his daughter is not allowed to return to work, I would remain calm and explain his daughter's condition and how it may inhibit her ability to perform the task she needs to do at work. I would also explain that we are focusing on working towards the ability to return to work, and returning too early could cause complications and put Violet out of work longer. If he were to start yelling and blaming me for her slow progress, I would remain calm still while explaining that it is normal for different people to progress at different rates. If he does not calm down after this, I would politely ask him to leave for the remainder of the session. To prevent this from occurring in the future, I would suggest that Violet attend her therapy sessions alone, or if her father insists on being there, or if she wants him to be there, have him wait in a separate space while she completes therapy. This would allow Violet to focus on her therapy and improve progress. Violet may become minimally compliant with her exercises and home program due to her depression and recent antidepressant medication, as it may decrease her motivation, and if she's still adjusting the medication, may still be making changes in her daily life. To try and help, I would reiterate how important these exercises are in her recovery process, and if not followed, could lead to complications. I would also provide her with handouts of the exercises she should be following as a reference when she is home, as it may be easier seeing the exercises versus just knowing what to do. If Violet began missing or canceling her therapy sessions, I would call her on the phone that we have on file and try to follow up with her. I would want to see if there was a reason why she canceled her OT sessions. I would also contact Violet's psychiatrist to let them know of her absence and see if she has also been canceling her other appointments. If Violet's progress began to plateau and she promises she will work harder, I would explain to her that given her previous actions, I'm concerned with her promise. I would explain to her again of the complications that can continue to occur if she does not do what she is supposed to be doing. It will delay her recovery and increase her chances of having a lifelong impairment. Regarding her discharge, I currently would not feel comfortable discharging Violet from therapy. She has the potential to progress and return function to her hand if she continued therapy. Regarding Violet's intervention planning, one problem I chose to identify was depression. This is important to address as psychosocial problems can impact outcomes of therapy. Depression specifically has the potential to hinder therapy progress and also impacts a client's ability to perform daily tasks, as we've seen in Violet's case. So a long-term goal would be that she will learn to identify maladaptive negative thoughts and independently demonstrate replacing them with more positive adaptive thoughts to increase mood 3 out of 4 times by discharge. And her short-term goal would be that she will explore and identify 2 leisure activities to increase participation in daily activities in 3 weeks. So I would do this through education mainly. So she will learn ways to redirect her thoughts from negative to positive and identify tasks or leisure activities that can help increase mood. It's important to teach these techniques to improve overall mood, as it'll also improve therapy. One way to upgrade this intervention would be by having her independently research leisure activities versus have me providing her with a list of activities for her to try out. And a downgrade for it would be participating in only one leisure activity. I based this intervention on the cognitive model as we're trying to change her way of thinking. And this would be an example of establish or restore intervention approach. A second problem I wanted to address was her decreased hand function. This is important to address as it impacts her ability to participate in and complete ADLs and IADLs. So the long-term goal would be that she'll demonstrate a 15-pound increase in right grip strength to be able to independently and safely drive self by discharge. I did this because in the eval, she reported that she was scared to drive as she only felt comfortable with her one hand still. And the short-term goal for this would be that she independently will participate in a 2-minute typing activity while wearing a dorsal blocking splint to show increased digit range of motion in 2 weeks. So I would do this through an activity. Specifically, I would have her participate in finger painting, which with the affected fingers to transfer paint from a plate to a canvas or a piece of paper, however she's painting. And this will help improve digit range of motion that will in turn increase her participation in functional tasks. And this is important for her to be able to move her fingers because she is a bookkeeper at work. So a way to upgrade this would be by having her use a paintbrush, which will help her on her pinch. And then a way to downgrade this is by providing a pre-drawn picture to where she just has to color within the lines. Some people may become overwhelmed by just drawing whatever they want, so sometimes providing them a picture makes the activity a little easier. And this would be based off of the biomechanical frame of reference and is another established restore intervention approach.